Hi there, nice to meet you. My name's Matt. I'm one of the NPs working with you today. You're Arnold, correct?
Yes.
Okay, can you tell me your full first name and last name?
First name's Arnold, last name's Nasambi.
Okay, and then date of birth?
July 16th, 1990.
Perfect. I just wanted to make sure I'm with the right guy. I'm just going to wash my hands here. Just letting you know we're going to be doing a physical. Should take about 20-25 minutes. Just an exam that covers you from head to your toe, running through quite a few things. Okay? All right, so first off, while we get into it, we're going to check out your head. Okay, so come over here. I'm just going to inspect. I'm going to palpate the head, feeling for any lumps, bumps. Is there any pain or tenderness when I touch?
No.
No lumps or bumps, nothing that I noted. Okay. Next up on the list, I want to do is I want to check your cranial nerves. Okay. So a few things. I want you to smile as big as you can for me. Awesome. Perfect. Now, what I want you to do is raise your eyebrows. Perfect. Good. Now, what I want you to do, squeeze your eyelid, squeeze your eyes closed as tight as you can. Don't let me pull them. Perfect. Okay. So what we're going to do, this is going to be considered soft.
Mm-hmm.
This is going to be considered sharp.
Okay.
I'm going to have you close your eyes. I'm going to do that to your face. You let me know if it's soft or if it's sharp.
Mm-hmm.
Okay. So close your eyes.
Soft.
Okay.
Sharp.
Perfect. Good. One additional thing. Can you puff out your cheeks for me? Perfect. Good. Got all that taken care of. I'm going to be assessing your eyes now. So just look directly at me. Everything's looking okay. Everything's symmetrical. Eyelids are normal. Eyelashes are normal. Okay. What I want you to do, I want you to close one of your eyes. Close your right. There you go. Close that eye for me. I'm going to match you, and we're going to check your cardinal gaze.
Okay.
So looking straight at my eye, using your peripherals, tell me how many fingers I'm holding up here.
2.
Good. How many am I holding up here?
3.
Good. Switching eyes. How many am I holding up here?
2.
How many am I holding up here?
4.
Good. Good. You got it. Perfect. All right. I've got a pen light here. We're going to check your pupillary reflex. Learn how to work this guy. Oh, there it is. Okay. So it's going to brace your head here. You're going to see a bright light shining into your eye. Look at me. And checking for pupil response. Good. Going on the other side. Checking for pupil response. Good work. Okay. Look at my pen light. Follow it. Don't move your head. Use your eyes. I'm going to make an H-like pattern. Checking all of your ocular motor muscles and the movement. Now I'm going to be going towards you. Fantastic. Okay. Next part of my exam, we are going to be doing the fundoscopic exam. So this is where I look at the inner structures of your eye and see what's going on. So for that, I'm going to dim the room. For this purpose, I think the lights turn off all the way. Yep, so, all right, I guess we can do this. You know, we're not going to do that. When I say I dim the room lights, we'll go with that. I'm going to look into your right eye. Using my right eye, I'm going to be making sure to brace your forehead, okay? So, bright light, looking at the inner structures. Good. Other eye. Looking at the inner structures of the eye. Okay, good. All right. We're done with the eyes. I'm going to focus more so now on your nose, your mouth, and your ears. So I'm going to go right to the nose or the mouth first. So getting my light back. I'm going to have you open up your mouth. Open up your mouth for me. Say ah. Perfect. Give me a big smile so I can see the teeth. Awesome. Good work. Okay. When you're doing that, open up your mouth again. Stick your tongue out. Move it side to side. It's another cranial nerve I check for. And again, wide open. Say ah. Good. Checking out the tonsils. Nice. Okay. Just cap here. Difficult to stay on. Okay. Okay, next I'm going to check your nose. Your nose looks fine to me. There's no asymmetry or anything like that. I'm going to touch your nose. It doesn't hurt when I palpate or anything like that, correct?
No.
Okay. I'm going to brace your forehead. I'm going to look in each nair. Pull your nose up like so. Okay. Checking the other nose. Okay. All right, switching caps. So I check the mouth. I check the nose. Now I'm going to be checking the ears. Okay. First things first, I want to inspect the ears. So just looking for any types of asymmetry, any pain upon palpation? No. Anything on the other side, pain upon palpation? No. Okay. I'm going to stand behind you and we're going to do what's called a whisper test. I'm going to whisper something into each ear and you let me know what I say. Okay?
Whisper.
Okay. And next one?
Test.
Perfect. Whisper test. Good. All right. Now I'm going to look inside the ears. All right. I'm going to brace your forehead here. Bracing your forehead. Looking inside your ear, checking the inner ear canal and the tympanic membrane. Good. Switching sides. Bracing your forehead yet again. Ear canal and the tympanic membrane. Perfect. Okay. All right. Portion's done. I've got this tuning fork here. We're going to do what's called the Weber-Renée test. So I'm going to hit this fork, place it on your forehead, and you're going to feel a vibration. You tell me if it's going on both sides, one side, or no sides. Okay? Come on. Okay. Both. Good. Okay, next step of this test, we're going to hit it. I'm going to put it up to your mastoid bone here, and you're going to hear a vibration. You let me know when you're done hearing, or when you're done feeling that bone conduction vibration. I'm going to switch it to your ear here so you hear an air conduction. The air conduction should be twice as long as a bone conduction. Okay? So just let me know. Okay. Let me know when it stops.
Stop. I can hear it.
Let me know when it stops.
I did.
Perfect. Okay, next up. Let me know when it stops here.
Stop.
Good.
Stop.
Good. Uh-oh. Is the camera still on? Perfect. Okay. Next up, I want to check your sinuses. I want to check your lymph nodes as well. Okay. Just going to push. Any pain when I push here?
No.
Checking the frontal sinus, frontal ethmoid, and checking the mandibular as well. Okay. Going to check the lymph nodes, feeling for the occipital lobes, postauricular, preauricular, tonsillar. Going down here, submandibular, submental, posterior cervical, anterior cervical. All right, clavicle. Perfect. Moving on to the throat, I'm just looking for any type of tracheal deviation or any jugular venous distension. Doesn't look like anything like that's going on. We're going to check out your thyroid too, okay? So I'm going to place my hands deep into your neck when I have you turn your head and swallow, okay? Helps me feel your thyroid. So we'll have you turn your head to the left, okay? And swallow. Good. Other side to the right. Swallow. Okay.
Yeah.
Okay, good. All right. Perfect. Moving on to the shoulders. Raise your shoulders up. That's my last radial nerve I had to hit. Perfect. Okay. I'm going to move on to the posterior chest exam. I'm inspecting the chest. I'm palpating any pain when I palpate here, Arnold. No pain?
No pain.
Perfect. Okay, I'm going to start with percussion here. So just listen to hear if I hear any consolidation. Okay. Just let me know if there's any pain, okay? Okay. All right. Arnold, what I'm going to do is I'm going to listen to your lungs. Each time I move my stethoscope on, the diaphragm of it, just take a deep breath in and out, and just keep on doing that with me whenever I move it, okay?
All right.
Perfect. All right, ready? Okay, and just on your side too. Perfect. We're gonna do what's called a vocal fremitus test, Arnold. I'm gonna have my hands on your back. I'm gonna move down in a ladder-like fashion. And I want you to say 99 every time I've moved my hands on your back, okay? Ready?
99, 99, 99, 99, 99, 99.
Okay, good. We're gonna do what's called the excursion test. I'm gonna throw up a Wisconsin W here on your back. I want you to take a deep breath in. I'm gonna look for any type of asymmetries going on, okay? All right, ready? And take a deep breath in. Good, and out. Nice work. Last thing I'm gonna check here is CVA tenderness to check out your kidneys, make sure they're not infected or anything like that, okay? You let me know if there's any pain or tingling when I do this. You're gonna feel a small strike right at your area of your kidneys on both sides, okay? Ready? Pain?
No.
Okay. Other side? Pain?
No.
Good. Okay, that's all for the back half. We're gonna switch over to the front side now. We're gonna do the exact same thing as we did here, okay? Inspecting the front chest. Just gonna palpate and touch you here. You got no pain or anything like that, correct?
No.
Okay. We're gonna do our percussion first. Okay. Okay. All right. Gonna listen to you now again. Same thing as we did before. Every time I move it, just take a deep breath in. Listening with my diaphragm. Good. Good. Excellent. Good job. Okay. Last thing, vocal fremitus. Feeling it okay? So say 99.
99, 99, 99, 99.
Good. Okay. I'm going to listen to your heart. This one you can breathe normal. Breathe in and out just fine. I'm going to listen with both sides though, just so you're aware. Okay? I'm going to listen with the diaphragm and the bell. Go for that second intercostal muscle. Listening to the aorta. And pulmonic. Herb's point. Tricuspid. And the mitral. Listening for any thrills, bruits, or murmurs. Okay, switching sides. Same thing, aortic. Pulmonic. Herbs. Cuspid. The mitral. Good. Okay. This next part, I'm going to have you lay down on the bed. I got a pillow for you. We're still going to be focusing on the chest here. So at this point, I'm looking at your carotid arteries. I'm looking for any type of JVD. Okay. I'm going to place a bell of my stethoscope on your carotid arteries. I'm going to listen for any type of bruits or thrills.
Right.
After that, I'm going to palpate it. Okay. I'm going to palpate one at a time though. Okay. You feel my stethoscope here? Good. Fantastic. I'm going to palpate now. I feel me touching on your neck here. Good. I'm going to feel on the other side now. Good. No tracheal deviations or anything like that. Feeling on your chest. I'm just feeling for thrills, heaves, things of that nature. I'm going to feel on your PMI, which is the 5th intercostal, midclavicular. You're doing great. All right. What I'm going to have you do, Arnold, is I'm going to have you lay on your left side.
Okay.
Left side line. Perfect. I'm going to feel on that PMI point yet again. and I'm gonna listen to it, okay? So. Good. I'm gonna listen with the bell of my stethoscope as well. Awesome. Okay. I'll have you lay on back. We're gonna go into the abdominal exam now. Just making sure we're recording still. Perfect. So what I want to do here is I'm gonna inspect, looking for any types of bruising, any types of asymmetry going on with it. I don't see anything. Next up, I'm gonna auscultate. I'm gonna listen to everything going on, okay? So I'm gonna use the diaphragm first. I'm gonna listen to each quadrant. Going right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Okay. Next up, I'm going to switch it up, listening with the bell. I'm going to listen to your aorta, your renal artery, your iliac artery, and the femoral artery. Okay? So I'm going to listen to the aorta first. Listen for any thrills or bruits. Now we're listening to the renal arteries, both sides. Moving to the iliac arteries, both sides. And lastly, the femoral arteries, and that on both sides as well. Okay. I'm going to check for the lymph nodes in the inguinal area, seeing if there's anything that's swollen. I don't see anything swollen. I'm going to feel for a femoral pulse on the right side. Good. I'm going to feel for a femoral pulse on the other side. Good. All right. Going back to the abdominal exam, I'm just going to be tapping on you, just percussing, okay? Trying to feel for that liver border. All right. So here we go. Okay. I'm going to tap in each one of the quadrants of your belly as well, okay? So right upper. Just let me know if you have any pain with this. Left upper, left lower, right lower. Perfect. Okay. Next up, we're going to go with palpation, okay? So lightly palpating each area. Right upper. No pain?
No.
Okay. All quadrants are palpated. We're going to go on to deep palpation now. Deep palpating lower areas. All right, now for this one, I'm going to deeply palpate on your right upper, feeling for your liver, okay? I'm almost going to kind of go underneath the ribs here. And what I want you to do is take a deep breath so I can feel that liver border, okay? Deep breath in, good work, and out. Nice job. I'm going to deeply palpate for spleen. I shouldn't feel it. Okay, good. If I felt it, that would have been splenomegaly. You ain't got that. So that's good. That's good finding. Okay, moving on. We're going to move on to the legs. I want you to let your legs be limp. I'm going to move them for you, okay? Just checking your range of motion. So, moving your knee up, lay it to the side, good. Bring it back, moving your knee that way, outward, flexing it up, awesome. And then get your ankle here, moving up, down, A inverted, everted, checking the other side, make sure everything's good. Okay, bringing this leg up as well, go completely limp, checking it to go up, okay. Lay out towards me, go in. No pain with any of this, correct?
No pain.
Okay, good. Checking your foot here, up, down, inverted, inverted, perfect. Okay. Now what I want to do is I want to do the same thing, but I want you to resist me, okay?
Okay.
So, coming up, I want you to go against me here. Good. Resist me here. Good job. Okay, raising your knee up now. Okay, resist me this way. Perfect. Resist me that way. Awesome. Okay, at your knee. Resist. 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 Good work. Strong. resist, good. Okay, lay that down. We'll get to the ankles in a second here. Just want to check the other side. Okay, resist me here. Resist me coming up, good. Let's raise it up. We'll raise it up normally. Here we go. Okay. Now push me down. Here we go. Push me down there. Good. Okay. Resist me here. Pull in. Good. Push out. Good. I want you to kick up, like at your knee. Kick up. Good. Resist me here. Good. Other way. Good. And then resist me here. Good. Okay. Go down here. All right. I want you to push down like you're pushing on a gas pedal. Awesome. Pull your feet up. Good. Resist me here. Inverting. Resist the other way. Awesome work. I'm going to feel for your pulses in the back of your knees. Checking bilaterally. Good. Got pulses there. Checking pulses in your post-tibial area. Good work. Checking pulses in the dorsalis pedis. Good. Okay. Wash my hands. You can sit up to the side now, Arnold. You're okay. Okay. We're going to talk about your upper extremities now. Okay. Same thing that we did with the lower, we're going to do with the upper. Okay. Before I forget, I'm going to check your cap refill time on your feet. And they look good. And I'm checking for peripheral edema and swelling of the legs. And that looks good too. Washing my hands. Let's check for capillary refill in the fingers. Less than 3 seconds. Great job. Checking for a radial pulse. 2+ pulse bilaterally. Good. Okay. Let your arm be limp. I'm just going to do a few things with you. Raising it there. Pushing it back. Good. Switching. I'm going to raise it all the way up. No pain or anything, correct?
Okay.
Flexing at the elbow. And then releasing. Flexing the wrist. Extending the wrist. Moving it both ways. Checking all the fingers. Making sure we got all range of motion of each finger. Good. Checking the other side now. Okay. Arms coming up. No pain? Okay. And then we're gonna go back. Good work. To the side. Fantastic. Checking the elbow up, out. Good. Checking the wrist. Flex in, extend out. Side to side. Each finger again, checking the range of motion of each one. No pain when I'm doing this.
No pain.
Good. Okay. You're gonna resist me now. All right. So have your arm, raise it up against me. Perfect. Raise your arm to your side. All the way up. Resist me, resist me. Good job. Okay, and then resist me going behind. So pull your arm back. Good job. Okay, other shoulder. Put the shoulders out of the way. Okay, pull up with your arm just like so and resist me. Nice. Pull up on your side, raising all the way up. Resist me. Good. Pull back. Fantastic. Okay, that's all done for the shoulders. We're gonna check the elbow joint now. Okay, so flex your arm inward like you're making a muscle. Good. Extend against me. Resist me. Good. Other side. Flex in. Extend back. Good. Same thing with the wrist. Resist me. Good. 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 Next one. Good. I'm going to squeeze your hands. Resist my squeezing of them. Good job. Squeeze my fingers. Squeeze, squeeze, squeeze. Good. Fantastic. Okay. Remember this guy? We're going back to it. So this is soft. This is sharp. Close your eyes. Let me know which arm I'm touching and if it's soft or sharp.
Soft right arm.
Perfect.
Sharp left arm.
Okay, we're gonna do the same thing with your lower legs. Let me know which leg, soft or sharp. Ready?
Sharp right leg.
Okay.
Sharp left leg.
Good. Okay. That's that. We went through that. When I have you close your eyes again, we're going to check for proprioception. So I'm going to bring a finger or toe up or down, you tell me if it's going up or down, okay? With your eyes closed. Here we go.
Down.
And now we're moving on to the feet with the eyes closed still.
Down. Down.
Good. Okay, so we got radial pulses, capillary refill, got all that done. Tuning fork again, we're bringing it back. Okay, I'm going to strike it. I'm going to put it up to your body. You let me know when you feel it, and then I'm going to stop it. You let me know when it stops. Okay, so we'll do your left arm first. Okay, ready? Close your eyes.
Feel it.
Let me know when it stops.
Stop.
Good.
Feel it. Stop.
Good. We're going to do that with your lower extremities as well. So, eyes closed again.
Feel it. Stop.
Other leg.
Feel it. Stop.
Good. All right. So, we did the sharp dull test. We did the proprioception. We got that done and out of the way. We're going to check your cerebellar function. So, with your hands, quickly invert them. Good. Sweet. We're going to do the nose to finger test. So, I'm going to hold my finger out here. I want you to touch your nose and then touch my finger. So, we'll do it with the, yep. Good. Keep doing it. Do it one more time. Other side. Good. I want you to take your heel of your foot and run it up your shin to your knee. As best you can. Good. And then the other side. You got it. Okay, cool. You got it. We're going to check for some deep tendon reflexes. Okay? I'm going to use this mallet hammer. I'm going to check your triceps, your brachial, and then your knees and your Achilles. Okay. So leave this arm be limp. Right there. Okay. Good. Next one. Good. Okay. Here we go. I'm going to do it like this. Okay, checking brachial now. Striking right in that elbow crease. Here we go. Good. Fantastic. Okay, I'm gonna check your knees now. All right. Just watching for that foot to kick out. Good. Next one. Good. Checking the Achilles. Good reflex. Good reflex. Okay. Deep tendon reflexes are checked. 2 of them in the upper, 2 of them in the lower. Next up on our list, we're going to do what's called the Romberg test. So I'll have you stand up for me, Arnold. Okay. And good. Stay right there. I want you to raise your arms straight out in front of you. Yep. We're going to have you close your eyes. I'm going to be on the side of you. And I'm going to watch for any swing. Okay. You're good? Perfect. Okay. Next up on my list, what I want to do with you is we're going to have you walk a couple paces. I want you to walk normally, walk forward. Perfect. Now we're going to do that again, but we're going to do it with you on your heels. So walk back only on your heels. Good. And we're going to walk on your tiptoes, going back. And then we're going to walk heel to toe like you're walking a tight wire, going back. Excellent. Okay. I want you to lean forward, bending at your waist, kind of reaching your toes downward. And I'm going to check out your spine here. I'm looking for any type of asymmetry or deformity that could show me like scoliosis or anything of that nature. Okay? You're good? What I want you to do, I want you to do a nice twist to the left, very slow, twist to the right, checking that range of motion. I'll have you dip your shoulder, there you go, yep, and then dip the other way. Perfect. All right. I got the face, I got the eyes, ears. I believe we got everything. Okay, well, the nurse is going to be in here shortly. She'll speak more with you and get you more of the paperwork. All right? Any other further questions, comments, concerns for me?
No, sir.
Okay, perfect. All right, Arnold. You have a good rest of your day.
That's it.